What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
Well, I want to speak to you both personally and professionally about something that's very important to me. When Alan was diagnosed in 2003, I sat there, I couldn't pronounce it, I didn't understand what the treatment options would be. The learning curve was so steep, I was nauseous, and I was facing the fight of my life, keeping my husband alive and taking care of my child. I went to look for supportive resources. I found very little. Everything was text-driven. The biggest benefit was a listserv, which is text-based, called ACOR, where I met Marilyn and Jill, who were just a lifeline for me. But that really wasn't good enough. I thought that we've come so far with technology. When we speak to the medical community, everything is survey-driven with percentage and actually reports and papers. And I thought in our community we could do a better job describing what we've gone through, articulating what we do need, and then filling in the gaps, hopefully with a resource-based document that will indeed help others. So I wrote a survey back in September, and obviously we sent it out using our ADAO networks. What I wanted to try to see was basically with shaping, sorry about that, and we missed the cohort section. Let's see if I can get back. Won't waste a second. A lot has changed since, for the last 100 years. We know that science has proven that asbestos exposure can cause disease. We do know that policy lags science many times, as we've seen with the Clean Air Act and some of the other issues. But we've also seen advocacy take a vital and important role. Jim Fite in our audience today started the first asbestos victims organization in 1979. Why is that important? Because we as victims get angry when we find out there's a history and there's a latency to policy action, because we know we can do better. So this survey actually was representative of 50 participants, and you can see down at the bottom it's 4 countries, and the age range was 20 to 60. I want to share the results with you so that we can learn together. Primarily, this survey was completed by women, and that's very understandable. I think because we're gender-based, we share actually probably a little bit more quickly than men, sorry. The average age was actually older. It was in the 50s and 60s, which I thought was also indicative of what we would expect because of late-stage diagnosis. Not a great surprise. But what I find true 10 years later is everyone is still searching for the same 3 answers that the Reinsteins had. We needed to tame chaos, and we were searching for a cure. The questions are simple. What do I do? Where do I go? And can you help me? We came up empty most times when we did ask those questions. So we wanted to ask in the survey, what did your medical team give you in the way of educational resources upon diagnosis? And I think that's quite a staggering statistic to put up there. It's nearly 90% people weren't given any information. And I know at Harvard Mass, you guys do a great job, so you're not in this pool, just so you know. They do a great job. Were you asked to join a support group? Cancer doesn't just impact the patient, it affects the entire family. And I think psychological supportive care is really important. And again, we saw very few patients and caregivers encouraged to join a support group. Well, this all makes sense to me. Let's see if I can explain it so that I can get the point across. When Alan first got sick, we had nothing called a smartphone. We were lucky enough to have a phone. Google wasn't yet a verb, and Facebook was unknown to us. But you can see the trajectory in 2004 with social media really taking off. And you see Google and Facebook on the far right side. This began a new trend, not only in technology, but also in patient care. So one of the questions I thought was important to find out was how many hours a patient and caregiver may spend online. And as you can see, the average is about 2.5 hours. Which was quite a bit of time when you think about the age group of most of the survey applicants were in their 50s. This Pew Internet and American Life Project survey I think is very interesting. On the far left side, it talks about access to internet. And you can see in 2000 where the bars are. And you can see almost it's doubled just in 9 years. But what's most important for me is we go there now to search for healthcare information. And you can see the growth in that field. Now, what our nurses said is true. Many times we search for information and it's inaccurate. And where do you find a good source? And I think this is where we can improve on where ADAO is going and laying some groundwork resources. What's changed this technology, I think, is the mobile apps. It's now simple, it's easy, it's affordable. My phone is my office, and it's also a part of my brain. If I lose it, can't find it, I've misplaced part of my life. But we're able to connect and share in such a way that has changed the landscape of how we're treated as patients and how family members respond to disease. So, of course, the obvious question is what social networking sites might you use? And it was interesting that Facebook clearly came up as the #1, nearly 90%, but you can see Twitter and whatnot. On the far right, you'll see blogs. Either people like to use their own, or they find help and care in other people's blogs. Like Heather's very active, and so is Lou, active patient bloggers. Why is Facebook so important? I love the fact that I think we can pinpoint it. It's really about the new conversation and community, and I know Anne would nod in that. Because we can connect, share, engage, and remember. It's dynamic and accessible. But we share everything now, not just a status update. We share sadness, we share happy news, fear, and we can share it in many different mediums. So what we wanted to find out is how did they actually, what was the benefit behind the networking of sites? And you can see that they really wanted to build community, access resources, advocacy was top, but sharing their story is very, very strong. Some of the quotes, there's over 50 of these, but we selected 3 that were most representative. But I think "I don't feel so alone" is the strongest one, because that's how Alan and I both felt, and I'm sure many of you did as well. Reducing isolation is a huge benefit from social networking. What did you most dislike? Well, it's no surprise it was unwanted solicitations, also concerned about inaccurate information. But by building authenticity and credibility, we can generate better patient resources that the patients and families can indeed use, need, and feel comfortable with. So the simple question is, did it work? Has it helped you? Well, slightly to greatly is what you're seeing there. And obviously almost 90% said greatly. And they benefit from various reasons, too many to explain in a quick PowerPoint presentation, but we have the data for a paper. I thought this was interesting because we wanted to know if the family was also engaged in the internet in search of resources. And as you can see, really, it's about a 50-50, but I would have thought that would actually have been a lower percentage, that maybe the children and other people weren't as engaged online as their parents or patient, but that's not true. So the UK Macmillan study, they do amazing work in the UK, and I think the statistic is very strong, that 1 in 4 cancer patients lack support from family and friends during their treatment and recovery, and you would probably nod with me and say, that is staggering and horrific, but probably very common. How many of these emotions have we as patients and family members felt upon a diagnosis? It's one thing if it's just in your daily life that you feel this, but this is a daily, hourly, by-minute feeling that we as victims often feel. Suicide is sometimes an option for patients because the medical care is so bleak. I'm finding less of that trend now with the advent of technology and better communities. So we all come together with various platforms. Those 6 are most common: Facebook, Twitter, everyone knows them, but you can engage and connect. But it's a community. It's not just going on Facebook. We see, we follow, we share. Lou is remarkable. She shares so much, and many other people in the audience do as well. So where are we now 10 years after Alan was diagnosed? I think these 3 buckets speak very strongly. For it's all about information, conversation, and advocacy. We know that we can find a plethora of information online. And we're looking there also for support groups. But it's the conversation that has become even more important sometimes than the information. And the advocacy side, our patients and families want to make a difference. Anne is here today, and so is her daughter. The trend is our children follow in our steps, and advocacy is monumentally important. So at the end of the day, I just want us to reflect on what patients and families do need. I'm hoping that this paper that we will write and publish will lead us to some better resources and safer resources. And at the end of the day, it really is about finding your balance and living your life, because no one can tell you what to do. It is your blueprint in life. There are no regrets. There are no rewind buttons. But the decisions we make, we have to feel comfortable with. And I think that these resources are monumentally important to patients and families and those left behind. And I want to just thank my collaborator on the analysis. It's Renee from Australia. Some of you may know Renee. She actually did some analysis on the survey results. So that's the genesis behind the survey and the results. Thank you.